Warning: this episode contains discussions of sexual violence, trauma, and systemic injustice. Some content may be distressing or triggering, especially for survivors. Please listen with care and prioritize your well-being. Support resources are listed in the episode description below. Hi listeners, and welcome back to the No Longer Silence podcast. In this episode, we'll be discussing surviving and mental health, and as we transition to the second part of our series with our professionals, we'll be kicking it off with two registered psychotherapists and resident community partners and therapists through the work they do with Revive and YWCA respectively. You will hear the voices of Darlene Cyrus Blaize and Gail Wilson as they share with us the work they do from a trauma-informed perspective and their very specific focus on diversity in the communities they serve. This conversation was deeply moving as both ladies shared their personal connections with the topic and some of the tools they have used to help their clients walk the continuous journey from victim to survivor, from silence to power. But before we hear the conversation, let's formally introduce our guests. Darlene Cyrus Blaize, ED.MA, is a registered psychotherapist with 15 plus years of clinical experience. She participates as a non-council member for the Inquiries, Complaints and Reports Committee at the College of Registered Psychotherapists of Ontario, CRPO. She also currently serves on the board of directors for Revive Peel, a community organization supporting survivors of sexual abuse and domestic violence. Additionally, she's an associate faculty at City University of Seattle, Canadian campus, teaching numerous courses within the counseling psychology graduate level program. Darlene's primary area of professional interest includes counselor education, development, and supervision. Her past research includes the development of counselor self-efficacy in the capacity of facilitating distance counseling. Her current research aims to explore the self-care practices of BIPOC clinicians who address race-based stress issues within their clinical practice. Her favorite self-care activity is taking meditative and reflective walks in nature. Darlene is a proud owner and founder of Fruits from the Roots, a culturally diverse psychotherapy and consulting private practice serving the GTA. Miss Gail Wedderburn holds an undergraduate and graduate level degree in social work. She is a practicing Afro-centered psychotherapist with over 16 years of direct social sector experience within youth criminal justice, women's health, immigration and settlement, social housing, academic teaching in adult education, and adoption and fostering. Gail enjoys the development of culturally relevant psychoeducational programs that has a direct community impact while evaluating the sustainability of these programming frameworks for long-term social change. In the last 5 years, she has been working in the mental health and wellness field in private practice, operating Gail Wilson Counseling Services, GWCS. GWCS provides individual clinical counseling and psychoeducational workshops to address anti-Black racism and to enhance anti-oppressive practice within community and organizational settings. GWCS also aims to address a plethora of mental health challenges in relation to ABR, such as but not limited to intergenerational trauma, anxiety, depression, and somatic presentations of internalized racism and race-related trauma. Gail completed a micro-credential in Impact of Race and Cultural Assessment, writing from the African Nova Scotia Justice Institute through Dalhousie University. Gail is also a co-founder of the Sankofa Psychotherapy and Consultancy Group, Inc. in Ontario, which operates as a clinical collective of psychotherapists and mental health practitioners with a direct aim to address the impact of ABR outcomes on a macro level. SPCG engages with community organizations around ABR training, healing, and capacity building programming for staffing bodies with lived experience of ABR challenges in their lives, as well as offering direct support to members of the African Caribbean and African Canadian communities. We'll start this episode with a conversation between myself and Darlene Cyrus Blaize. Then you will hear me speak with Gail Wilson. This is the No Longer Silence podcast. Topic: surviving and mental health with me, one of your hosts, Khdrea Jones. Let's get down to the business, right? So it's Victims and Survivors Week 2025, and the theme this year is the power of collaboration, which is exactly why we have paired up with YWCA Toronto to deliver this podcast. As a clinical psychotherapist, when you think about the theme of the power of collaboration and mental health professions and how you work, how does this theme stand out to you?
Yeah, as a registered psychotherapist, um, the therapeutic process is one in and of itself of collaboration. It's individuals showing up with such bravery to say, I'm struggling and I'm having a really hard time, and I am deserving of support, and I'm going to access that support. And so they reach out to see a therapist, and the therapist, a good therapist is going to be client-centered, is going to want to meet the client where they're at, work with them to help them accomplish their goals towards wellness. And so the very nature of the therapeutic process is one of collaboration, right? I see it as such a foundational part of the work that I do is meeting individuals where they are. I want
Mm-hmm.
to say, for maybe some context, when I was invited to speak on this podcast, it there were so many mixed emotions. I had so many emotions about it. One, because it was such a what is it's humbling to be asked to share expertise and knowledge about a topic. That's a very humbling thing, and I'm very honored and humbled by that. Two, back in November, Revive had their first inaugural gala, and there was a story of a young lady. I mean, it was a very empowering event, right? And there was this one story that just impacted me on a very profound level. And a part of it was because on a personal level, I could relate to that story.
Mm-hmm.
I am a survivor of childhood sexual abuse, and I've I've never actually publicly shared that.
Wow.
Um, yeah, and that's why this was met with so much emotion
Mm-hmm.
because I was like I left there in November thinking, wow, like here is this young person who has so brave and courageous to talk about their experience, right? And this was like part of like a story that they were sharing, right? But the story of it, and of course a real story, right? This is a real person, but they were anonymous. But hearing the story of it touched me because I could relate to that story. And I was thinking to myself when invited, and tied the collaboration with the YWCA, like it was almost like a full circle moment
Moment.
for me
Wow.
because the 2 summers after I had disclosed what was happening to me, I attended a summer camp at YWCA. And I distinctly remember feeling empowered. And it wasn't even that the YWCA at the time, the camp that I was attending to, was specific to survivors of sexual assault or domestic violence. That wasn't it. It was just a regular summer camp. But the counselors, the way that they like encourage you to challenge yourself, to just to do the activity, they built so much confidence. And I would say 2 years since I was essentially safe from the abuse. I remember having this really profound moment at the camp thinking, wow, I'm safe and I'm being empowered and I matter and I'm part of this like team, part of this environment with these other campers. And it was just so mind-blowing of an experience, and I kept it in the back of my mind. And so when I got this invitation, I saw the pairing, the collaboration with the YWCA with Revive. I just thought, wow, I feel like this is an important issue for me to no longer be silenced about, to share with folks that while you've survived events that for me were traumatic, for many folks traumatic, and you were not deserving of that, there's also opportunity to thrive. And that has really influenced even my stance on therapy of, yes, we know that there is post-traumatic stress disorder, but there's also post-traumatic growth. And so
Mm.
that's often the lens in which I look at things is how do we grow from trauma? And that's really, again, that's what's influenced me. So I thought it was important for me to just give that context because my sharing is that of, yes, Darlene, the registered psychotherapist, and it's also Darlene with personal lived experience being a survivor of childhood sexual abuse.
I
So,
mean,
yeah, that's
honestly, we
important for
could
me to share
we
that.
could probably just end the podcast right there. Hearing you say that this experience is not just about your work, but about your lived experience, it's even more fulfilling because I know for you it heals a part of you
Mm-hmm.
while you're helping others to heal.
Yeah.
And how do you move from being a victim to a survivor? Because I think I really
Yeah.
wanted to make the definition or what that experience is like very distinct. Because oftentimes when people speak about their experiences, they say, "Oh, I'm a victim," but then there are other people who will say, "I'm a survivor."
Mm-hmm.
And I just want to know if you could help our listeners and our viewers to walk through what that process is like as someone who has lived it and as someone who helps others to move through that experience. And of course, this is not something that leaves you. It
Yeah.
it's a part of you. But like you
Yeah.
said, there's post-traumatic growth.
That's a pretty loaded question. Um, so I do want to start by acknowledging that healing is not a linear process. And being exposed to traumatic events can have many implications, right? It can affect you on a physical level, an emotional level, a psychological level. It's just so profound, the impact. And I raised this point because from a psychological and emotional level, there could be feelings of distrust, not just of other people, even yourself. There could be, and that's a whole other, that's like a big piece that we don't have all the time for it to get into. There can be feelings of shame, a sense of confusion, anxiety. There's just so much that could influence how someone experiences that trauma. And when we factor in, we think about maybe the person, like developmentally, where the person's at, the lived experience, all of that couples and could influence how someone copes with a traumatic event. And so for many folks, that confusion could lead, and understandably so, to seeing oneself as a victim. And the reality is that there was a violation to your being, to your body, and it's not fair. It's not okay. And in that sense, it's very true that this unfair, unfortunate thing happened to me. And to help support individuals to get to a place of recognizing that that is not their fault. They're not to be blamed. To find, uh, and this might be hard to say, but to find meaning, something bigger than yourself, is what helps to even lead to post-traumatic growth. And that is a process that requires support from a trained, often trained professional, right? To help you untangle some of the internalized messages and beliefs that may have developed of being violated, having your
Mhm.
being violated. Um, and it's so nuanced because everyone's situation and how the traumatic event unfolded, like that could influence the types of internalized thoughts that are unhelpful for the individual. And so being with a trained professional to untangle those thoughts, to think about how do I move forward? How do I demonstrate resilience as a result of this adversity does require space. I don't even want to say time or because there's no time limit. It's just it requires a safe space to engage in that process. At the same time, again, once being given the safe space, having a professional who's trained in appreciating post-traumatic growth, which again is being able to look at a traumatic event, be able to support the individual to see the ways in which they themselves have grown, the skills that they have developed to survive, finding meaning. And I'll use myself just as example, being able to provide even just this lens of post-traumatic growth is meaningful for me and my own healing, to help to encourage others to realize there's so much research around factors, resiliency factors. Science tells us when we look at those factors that we can thrive, like we can actually make a difference in the world, that we are not defined by that trauma, that we have agency in showing up in the world and influencing it and creating the narrative, the story that we want to put forth. And that is the growth. But it
Safe.
takes a safe space. Yeah.
And I love how you walked us through that because, like you mentioned, a big part of this is acknowledging, firstly, that this thing happened to you.
Hmm.
And this is not something that you asked for. This is not, there's nothing that you did to put yourself in this
Right.
position. And
Hmm.
then after acknowledging that, and, you know, as you said, finding a space where you can work through that, then you can move to a space of where you're able to say, I am a survivor. Growth and healing isn't linear. So there will
Hmm.
be days when you think, I am empowered, I am empowering, and then there's gonna be events and there's gonna be things and there might be people, sometimes even your family. You go back home and then those memories come back and that will hit you like a ton of bricks. And then you feel as though you're back at square one where this all began.
Yeah.
But even when that happens, because you would have been through the journey and found the space where you were able to find empowerment, you can know that, you know what, I can find my way back there, even though I'm having this experience right now. So it's important to acknowledge those feelings and then move from that point on. So, how would you advise families to support victims and survivors, especially in cases where probably they noticed something was wrong, but they weren't able to connect with the person to help them through it, or they just didn't know what
Hmm.
to do, and probably the survivor is not at a place where they're willing to talk about their story or they're trying to move beyond what they've been through. How would you advise families to help in situations like these?
Yeah, it's such a great question. Being a part of a community is also one of the pillars of post-traumatic growth. So I appreciate you brought that forward, that post-traumatic growth really thrives in community. And so if a family member approaches you and shares this, the first thing I would say, believe them. Don't minimize, don't dismiss what they've shared with you. I understand that in certain family dynamics, precisely that, there are family dynamics. And so maybe some folks may not believe, which is unfortunate. At the same time, if that is the case, can you at least encourage the person to connect with community, connect with connect with community resources? Maybe you as a family member may not have the knowledge, may not know, may feel, I don't know how to support this person. And even if you don't have the knowledge of where to direct the person, encourage the person to keep talking, to share, to not be silenced. Because shame, shame like silence,
Mm,
like they go hand in hand. It's like if I can make this person feel ashamed, or I can make them feel guilty that they've done something wrong, or that them talking about this is them doing something wrong, that can likely perpetuate this feeling of shame. And if shame is present, then that person is likely going to be silenced, because shame just does that. It critiques
mm-hmm.
you. It makes you feel like there's something
Makes you
wrong
feel
with you.
small.
Yeah,
Mm-hmm.
you're not, your thoughts, your experiences are not worthy of being shared. And so we don't want to perpetuate anything, any messaging that would increase the likelihood of someone experiencing shame.
Mm-hmm.
So be thoughtful of your response, be empathetic, compassionate. And even if you don't have the answers, encouraging the person to keep sharing with trusted individuals, to connect to resources, that's going to be a huge buffer. That's an antidote against like silence, or the antidote to dealing with shame. It's like, no, I'm going to have a voice. Encourage that person to have a voice. Encourage them to seek out community support, be around others who have shared experiences and they're on their own journey, but you guys can support each other. It's not trauma bonding. It's finding a sense of community and social support.
Mm-hmm.
Like
Okay.
Revive has really great resources for folks to connect as a community, right? So individuals can see again that they're not alone in such
Mm-hmm.
situations. Trillium Health Partners, right? They also have resources and supports for individuals to connect if they are survivors of sexual assault and domestic violence. So, as a family member, you could encourage folks to access these resources, even if again, you don't have the answers. You might feel like, oh, this is out of my depth, but encourage them to access those resources, and people that goes a long way.
Like you mentioned earlier, while therapy is important, the whole process of healing and
Hmm.
wholeness it's very collaborative. And most times the body and
Mm.
the mind they work together. And so sometimes things might
Oh yeah,
manifest physically and you're like, I don't know what's going on with my body. I don't know what's happening. It might be a mental thing. So tell me what some of those side effects are that victims might see themselves going through and they're probably thinking, oh, I'm probably just sick, but not
yeah,
realizing that it's something else that's going on inside.
for sure. So I just full disclaimer, I'm not a medical health professional, right? So I just want to be mindful when I speak of some of the um, physical health
Hmm.
symptoms and impacts. Of course, you still want to talk to your primary physician. I can only speak on the connectivity as a clinician, as a registered psychotherapist, what I know. So first, experiencing a trauma, your body is physically facing a threat. And so we know that cortisol levels, right, like your stress hormone, like all of that is going to like increase and prolong exposure to cortisol levels can have a significant impact on you physically. And again, that could vary from person to person, but you might have some folks who experience gastrointestinal issues. Some folks experience chronic pain that they've never had before, like constant migraines or back pains, pelvic pain. And that's just their body reacting to the prolonged stress of facing that trauma. Um, it can lead to cardiovascular diseases, right? That the high cortisol levels, the impact on the cardiovascular system. There's research highlighting that. There could be, if you're in that constant face of a threat, that takes a toll in terms of even energy levels. You might feel yourself constantly fatigued, but also having a hard time sleeping,
Mm.
right? So those are some of the physical health pieces that are symptoms that you could experience. Um, Along that note, for folks who have been who've experienced human trafficking, there could be neglect of medical attention
Mm.
of your physical needs. There could be malnutrition from not getting the adequate amount of meals and nutrients that your body needs. There could be untreated injuries that require being tended to, but have been neglected
Mhm.
by the traffickers,
Yeah.
right? Um, there could be, on a physical level, there could be concerns regarding sexually transmitted infections and diseases where you haven't been able to get proper evaluation or treatment, right? So there's all of these physical health components that require, again, attention and being tended to by a physician. And then being exposed to traumatic events and the stresses on a mental health level. You know, what I see from clients who have experienced such traumas, it could lead to PTSD, right? It could lead to depression, um, anxiety. There's also disassociation. And disassociation, as you were talking about the mind-body connection, disassociation can happen when we're facing such a profound trauma that the body and the mind, in a way to preserve itself, to survive, kind of disconnects from itself. But then that leads to disintegration. And as you noted, to function optimally, we want an integration of the mind and the body. We want them to be integrated, right? To feel that sense of wholeness. But if you're facing a trauma and it's prolonged trauma, you're like in this in this really stressful situation, prolonged exposure to trauma, folks tend to disassociate to survive it.
Mhm.
And so then we see disassociation as clinicians, and people are so disconnected from themselves. We might see folks engage in certain behavioral behaviors, such as substance addictions or process
Right.
addictions, as a way to cope, right? 'Cause, dealing with the stressor of the trauma, like I'm going to cope in this way. Individuals might engage in self-injurious behaviors or self-harming behaviors, may experience thoughts of suicide. And often what we see with the thoughts of suicide, and of course, you know, each clinician has to do their full evaluation regarding risk factors. So make that known. Something that we do see though is often it's not that the person wants to um, experience death by suicide. It's not that they want to themselves die. What we see is more so when individuals express suicidal ideation, it's, I don't want this pain. I don't want this trauma to happen. I want the pain and the trauma to die.
So go away.
Not, yeah, not that I like, it's not me. Like, I want to be here, but I want to be here without the pain and without the trauma. Right? And so we work with the individual around how do we demonstrate adversity and resilience and keep going while we reduce the pain
Mhm.
and we address the trauma, putting the person in, finding them safe spaces so they're no longer exposed to the trauma. And then
Right.
that makes life livable. Yeah.
And when it comes on to even these responses, when a survivor has the opportunity, for example, to go to court with their perpetrator,
Hmm.
I imagine that that can be a very triggering experience because you're here to seek justice, yes, but at the same time, seeing this person,
Hmm.
remembering what happened to you, probably puts you back in that position.
Hmm.
How do you advise in situations like this for persons to ground themselves? And then my follow up to that was, as you give trauma informed care, what are some of the tools that you, and I know we mentioned breathing and grounding yourself, but what are some of the
Hmm.
tools that you often use or advise clients to use that our viewers can and our listeners can listen to and that they can take with them and probably share with someone they may know or even practice for themselves?
Yeah, it's a really great question. Yes, I'm pausing here just because everyone's plan is going to be
Different.
individualized and different. Yeah. For some folks, they might have a hard time, like you were saying, putting your hand to your chest, doing that embrace. For some folks, that could be really powerful. And we know even if you could do it like skin to skin, so like actually remove the barrier of the clothes, that could be really helpful. Of course, you gotta be mindful of where you are, what's appropriate in terms of your environment. But
Hmm.
the closer you are to be able to enact skin to skin, the better. This is why when babies are born, they put the baby on the parent's actual skin. Like it's very soothing. Um, so that can be really powerful, but for some folks, being so close to their body can also be very triggering too. So that's why I say it's really an individualized thing. So that's why I'm like hesitant around like what I share.
Hmm.
Um, and I shared some of this a little bit before, and the reason why for some folks, because particularly for folks who have experienced sexual assault, there is a phenomena around like the body betraying, feeling like your body betrayed you in the moment. Um, some folks might be really confused because they're like, here's this horrific, traumatic violation to my body, and yet my body may feel aroused. And that's really confusing for the individual. And they then they internalize these feelings of shame or guilt, up, upset towards their body. But again, your body is just responding to sensory. Like
Hmm.
it just is. If it's being touched, it's being touched. And it's just responding. It's doing what it was created to do. And so part of it is working with individuals to explain that so that they could have more compassion for themselves. Um, but at the same time, just recognize that for some folks that that's still a process and that can be really challenging for them to reconcile. So, and then some people, as I mentioned, they might experience a lot of chronic pain within their body. So doing some of the body exercises might be really uncomfortable for them and might be too much as well.
Yeah.
So it's a very individualized thing. However, we do know that regulating yourself, take a moment. I always say it's if anything, maybe I can give the 4 R's here. So I'm not giving it a specific um this is what you do, but
Hmm.
more of a process. So you first want to recognize that you're you're reacting to what's happening externally or that the situation that you're in is feeling unsafe. The next thing is you want to actually retreat. So you want to take a step back. When I say retreat, it's like take a step back. Get yourself to a place of safety, of perceived safety. right? Where you're not facing that the threat, whatever it is, you're not like immediately facing it because you need to give yourself a chance to then get to that next R, which is regulate. And then that regulation could be, like I said, individualized to the person. For some folks, it could be the humming, it could be the deep breathing, it could be the meditation, it could be whatever. You have to regulate, regulate. After you regulate, the next piece is, and it's a very important component to the four R's. You need to return to the situation, to the thing that felt, that activated the stressor. You have to return to it if it's safe to do so. If it's safe to do so,
Mm-hmm.
but if it is safe to do so, then return. We don't want to, the reason why that return is so important is because in that moment, you're demonstrating your sense of power and agency to face that distressing thing. If we retreat from that distressing thing and we never return to it, that then is avoidance.
Mm.
We're not facing the thing. We're not dealing with the thing. So the return after you've regulated, and it is, of course, it's safe to do so, that is you demonstrating your agency. You face showing back to face the perpetrator. That is you demonstrating your agency, right? That
Yeah.
is you empowering yourself. And realistically, you do whatever feels safe and right for you. If you don't want to face
Right.
that perpetrator, then don't face that perpetrator. If you want to face the perpetrator, right? The same with when people sometimes people say, well, how come this person never reached out or how come they didn't like report this? Everyone has to do what feels safe and right for them in that given moment.
And that is a process.
And that is a process. Exactly. Exactly. So I don't want folks to say, well, if you leave, if they don't return to face the perpetrator, does that mean they're not like, no, that's not what I'm saying. It's more so I'm more so saying in situations where we're feeling distressed, an important piece to reclaiming our sense of agency is not just to retreat and not come back to face that thing, because
Mhm.
that then perpetuates this idea that that thing that stressed us is bigger than us.
I know when we did your bio earlier, we talked about your favorite self-care practice, which is, taking long reflective walks in nature.
Hmm.
And I just wanted you to leave our listeners with three self-care practices that they can do for their mental health. Just practices that they can do in general to help
Yeah.
improve their mental health.
So I would say, okay, self-care practices. I want to, maybe I might add this piece. I do think that there could be value in speaking with a trained professional, whether it be a counselor, psychotherapist, psychologist. Like there's value in that. And they could then help and create an individualized plan of self-care for you. In terms of self-care, it's going to be important to recognize that self-care can happen on different dimensions because we as human beings, we have different aspects to us, right? And
Mm.
so you can have physical self-care, emotional self-care, psychological self-care, work self-care, spiritual self-care. Like there's so many different dimensions. Um, so you could do um, a psychological self-care could be something like journaling, doing some reflection.
I do love a journal.
Oh, I
Love.
amazing. Yeah, yeah. What do you love about it? Would you be able to share?
Yes, of course. For me, it's more sometimes my mind gets really cloudy. And it's
Mm-hmm.
just because there's a million thoughts going around, a million emotions that I'm feeling, and I'm unable to process it sometimes because I don't know exactly what's going on. I just know I'm
Mm-hmm.
feeling a lot. And
Yeah.
journaling helps me to make what I'm feeling very clear because it allows me a moment to stop, think about, okay, what exactly is it that you're feeling? And
Mm-hmm.
then I'm able to process the emotion and write it down. And I think sometimes I just need to dump it somewhere
Yeah.
and writing it. is just that mental dump. Because I can talk to my
That's the
friends
part.
and I can talk to my family and I'll probably feel a little lighter, but it's still in my head. And
That's the
so
part.
taking it
Hmm.
out, putting it on paper and just leaving it there is so empowering for me. And
Yeah.
I tell everybody to journal. That journaling, if you're out there and you're listening, I'm a fan.
Yes,
I
it is
really believe in it.
so, yeah. You hit the nail on the head with like all the benefits. And the big piece is, as a psychotherapist, is being able to take all that is muddled and tangled in your mind and externalize it. When we externalize it, it makes it so much more tangible. It provides clarity.
Hmm.
It can provide perspective. It takes a lot of energy for your being, your body to actually keep all of that in your mind. When you externalize it, you've given your mind new information to say, I've done something with this.
Hmm.
So I don't have to hold on to it.
Right.
Whereas if we don't do anything and we kind of, it's just like playing, it's just there and we're like, oh, I'm thinking about this and I come back. The mind still thinks, oh, there's something that needs to be done. It's like having like so many apps on your phone. Like it's in the background taking up energy. So when you externalize, it's helpful because then you
Hmm.
can say, oh, I can kind of close that app, right?
Yeah.
So I love that you journal. I love that.
And
Therapist approved.
I like that you put it that way because I think that definitely makes it more relatable in terms of the apps that are running in the background on your phone. You're like,
Mm-hmm.
why is my phone dying? It's dying. So
There you go.
close the apps. Close
Yeah,
the apps.
yeah.
Yeah. Yeah.
Close
Write
the
that
apps.
down. Write that
Okay.
down.
Close the apps, right? Journal. Journal is like closing the apps. I love it.
Yeah.
The other thing is, you might want to think about as self-care. Like I said, there's numerous things on different dimensions, but in the scope of what we're talking about here, I would say another important self-care piece can be on the social dimension of connecting with others. That's an important piece of self-care.
That's what we do
Being
at
able
Revive. We
we
build a community here.
didn't plan that. We didn't plan
Yeah.
that, but we really didn't though. But it's true. It's true, right? It's like that's the whole essence of Revive is being able to have that sense of community so you're not healing alone. I mean, I can't stress it enough how important it is for us to be in communion with others. I think about just, being um a child of a Caribbean descent. I think about back home in the Caribbean, like there's community, like there's just such that sense of collectivist and like belonging and working together, and there's something healing and transformative about that. And so we know that being with others, getting support from others can be a huge form of self-care.
Hmm.
Um, and then the other thing that I would want to say, this might be cliche, but it's so true, and we've talked about this, is the importance of nourishing your physical being. Whether it's like what you put into your body, and I say like what you put in, like what you consume, not just food, but like
Ooh.
messages, images, what you read. Like you're consuming all that. Like think about what are the things that I want to consume? What do I want to fuel my body with? Right? If we're only exposing ourselves to things that cause us stress, the body's going to feel that. It's going to be impacted by that. Just be thoughtful, be intentional about what you consume because it is going to have an impact on your being, on your essence, and how you,
Mhm.
yeah, what you meditate on and how you show up in the world. It just does.
It comes on to this topic, there is so much more that we could
Of
explore,
course.
and we will definitely continue to explore. This is just season one, so there is so much more to come. Thank you so much, Darlene, for sharing with us. Thank you for not just sharing in your professional capacity, but also sharing your lived experience with us. You are so strong. And I appreciate that you were able to feel as though you were in a space where you could share your story with us. And even though you might not have gone into details, just knowing that you have a lived experience and you bring that to the discussion is enough. And we continue to wish you all the very best on your healing journey as well, because as we
Thank
said,
you.
it's not linear.
No, Khdrea, thank you so much. Thank you, Revive Team YWCA, for allowing me to be a part of this conversation. Thank you so much, and thank you, Khdrea, again for the space that you've held.
No problem. Until next time, walk good. Welcome, Miss Gail Wedderburn, to the No Longer Silent podcast. So, Gail, tell me about your journey in working with survivors of sexual violence and how it connects to mental health. Okay, so my journey with working with survivors of sexual violence and human trafficking, to be honest, has been through my work in youth justice. So when I started working in youth justice, there was a growing trend at the time of how people were being lured, whether it was through their peers or through poverty related issues. It became a growing issue, whether it was male, female, whatever the case was. And there was a growing interest, especially because it was happening predominantly in communities of color. And a lot of the work that I do and has always strived to work in is to work in communities that look like me. So in terms of my work and working with people of survivors of sexual violence and human trafficking, it's really been about how I'm able to engage them after they've sort of come out of that process, how to support them to maintain their wellness and connection to community so that they don't end up back being trafficked, right? So there's a lot of building rapport, building safety with clients. It's not easy work. It's really difficult to work with people when you hear their stories and the things that they've been through and how it connects to the varying systems that have failed them throughout their lives. You know, at the crux of it, a lot of it is poverty and feeling unseen, right? So in terms of just my work with it now, I haven't necessarily engaged a lot of clients right now due to my own wellness, but in the past, I've worked with quite a few young men and women trying to work through their mental health and wellness to get out of being trafficked or having to deal with the healing of having experienced sexual violence. So when we're working with people who have experienced sexual violence or human trafficking, it's really about how do you teach or support them through grounding, teach them ways to connect with their bodies slowly, whether it's through somatic experiences like what were things that they can connect to, like dancing, swimming, physical activity that allows them to move their body and to feel a sense of control with themselves, really sort of seeing how they can connect to community, right? Because any type of healing where there is a disconnection with self often needs to find healing within community and also within oneself. So healing is not a singular aspect. So when I work with my clients, I kind of express to them, hey, we're going to do some one-on-one work, but really and truly, you have to be able to be well-rounded and balanced. And that may mean getting out in community, and that may mean dance classes or anything that where there is movement and allows for your body to feel like yours, where you can start to feel like there is a sense of control with your body. There's that. So that physical side, the emotional and mental side is really how you're building that affirmation and the narrative within your mind, right? Taking back your power by speaking word to power, telling yourself, and even having like a buddy, right? Like even if it's like a best friend or some peer along the way, even your therapist can be that for you, but never a crutch. That's really important that your therapist never is a crutch. It's just a support and a mirror along the way, right? So supporting to anchor a new voice, to recognize where the negative voice is and what it looks like, what it sounds like, what it may feel like, and dispelling it, really sometimes even just screaming it out of your body and literally screaming it out of your body and saying for it to get out, for you to repossess your body, to say, this is mine.
I'm in control of my body. I'm in control of my future. So things like affirmation, grounding, somatic movement, these would be sort of my recommendations to clients, right? But it's a slow process. It's never ever something that just happens. It's a build up with encouragement, with understanding what may be of interest to my client, what may work for my client or not, who's within their circle of support, whether from the community, from family, from even chosen family, because sometimes it's not just family.
That's so powerful. Do you have a favorite affirmation that you use?
So for my clients, I will tell them a sequence of how to affirm, never what to affirm, because then it takes away the power from the client. So in a psychotherapy relationship, I will teach you about this tool, but I never create a tool never create a pattern for you. That way, my existence in your life is on the outside rather than on the inside. So when you create this affirmation, I often will teach you about the I am, the I see, that I call. So I teach you the starting words and then you fill it in, right? You can fill it in. So I am grounded in, I call to myself, I am worthy of, you know what I mean?
I love that. Yeah. I think that's also, and like you said, it's taking back your power. Because when persons were probably abused by someone who was narcissistic, they take that away from them. They lose the ability to see themselves as powerful, as loved, as someone who is confident, someone who is able to do the things that make them happy and to also bring change into different spaces. So giving them the ability to take back that power is special and so important. So yeah, I love that. And I hope our listeners also try to practice some of those affirmations. Now, after you finish listening to the episode, but take some time to stand in the mirror, stand in your truth, and take back your power too, because you are whatever you say you are.
Yeah, it's really supporting them to highlight what is true and what is reality. Because sometimes when you've been through so much stress, so much harm, so much trauma, you can't really tell the difference, and you think that everything is you create this narrative that can be very toxic and negative for yourself, right? So, I would say I tell my clients, name three good things that's happened today or over the week, right? And hold on to that, right? And be grateful for wherever that may be, and know that everything is within your capacity. Whatever you're trying to do is about your capacity. It's about your time and how you're connecting with community, right? So when you feel like, oh, you've had a setback, it's really about being graceful with yourself and then knowing that everything is going to come in its own time. When you feel a setback, know that you have a limited amount of capacity. And what does that look like? Sometimes we put too much pressure on ourselves and expect that, we should somehow be somewhere else because other people are there. No, you have a capacity and that's where it's at, and it's linked to time. And then community, how are you connecting to community and not feeling that a lot of times people who have dealt with trauma tend to want to always do things all by themselves, right? Really and truly, it's that no, there is community. We have community. Yes, there are things that we independently should be doing on our own to build capacity, to build up who we are, to feel more confident in self, but we don't exist as an island. We exist within a social group. So it's all about timing. It's all about capacity, and it's all about community. So whenever you feel like you've had a setback, no, everything's about time. Give yourself that grace. Speak kindly to yourself, and hopefully you'll have a buddy in community that can also speak to how far you've come. Because sometimes we always have this tunnel vision of what we see, right? And then we don't really see all the blessings and all the amazing strides that we've made by just one mistake. We're like, oh, everything's so up and mad about myself. But no, you've made lots of strides. You just need to actually sit down and say, like, many of us have the tendency to, where we've made strides, but we don't celebrate it. We don't celebrate the stride. So then it doesn't anchor. We're just like, next thing, next thing, next thing. And the one thing that we don't get right, it's like everything blew up. And it's like, no, you made huge strides. Huge strides.
What would you say to someone who is probably struggling to be no longer silent and admit to their community that, hey, have been violated, they're having a hard time being able to say that to the community.
So there's a difference, as I said before, between assigned community and chosen community, right? So chosen community is the group of people, places, and things that you're going to engage in based on your interests, based on things that you know that is aligned to where you want to be. An assigned community can be what your parents or your culture says that you should be around, right? So there is a place in life where you have to kind of create that balance of where do I want to connect and create boundaries with my assigned community, and where do I want to connect and create boundaries with my chosen community and find the even balance, right?
Yeah.
So you don't always have to be connecting to community based on family, friends, community, some sort of crazy obligation that you feel that you need to have. No, community can be created. You can choose community. It's your choice, right? So community can look like, okay, I had this really good group of artist friends that I used to like to go paint with, or, I want to be painting. So maybe I go find a place where they do creative painting. Maybe I'm interested in books. So what's the nearest coffee and books place that I can go to? You know what I mean?
Book clubs around.
Yeah. Or, maybe I want to learn soca. So what's the next soca place that I can go, wind up and whatnot, right? So yeah, it's community is chosen. It doesn't have to be assigned. It's all up to you and how you find that balance in between. So definitely there will be that fear of how to connect, but people need to understand that a lot of the answers that we're looking for are always inside of ourselves. It's being able to innately trust the message that we have within us and heighten our own voices, block out the negative voices that have been created over a period of time, and really bring your voice to the forefront. What is it that you'd want to connect to? What is it that you want to see to bring to light for yourself? Who do you want to connect with? What does that look like for you growing forward? That's what you need to connect with. That's where community is.
And in the case of the community, when this person has decided to stop being silent and speak about what has happened to them, how can the community show up and really support them?
I really think that because there's just a global conversation about wellness right now, that most people, I would really implore you to be curious of wanting to know what mental wellness is, right? Because we will go to, like people will say, we'll go to the doctor if we have a cold, if we have a flu, we take care of physical health, but your mind is, and your brain and your head is attached to your body. So all of it needs to be working together. And as a community, if we kind of get rid of that stigma of, mental health and, it's this crazy thing that we don't want to talk about. No, let's get curious. Let's get educated. Let's have conversations. Let's agree to disagree. And that's the only way forward for all of us to feel more healthy, much more supported, much more engaged, moving forward in the next generation. I think that we are actually doing a better job of it because there's much more conversation, much more action towards it. And really and truly, it's just about how are you supportive? How are you learning? How are you being curious? There's no room for ignorance. Let's leave ignorance at the door. And if you, as a community, you find someone coming in and they're being ignorant, I wholly say kick them out.
Show them the door. I agree. I mean,
and we have to be mindful too, right? Like, even, yes, we have relationships in our lives where we'd want to keep them, but some people don't have the capacity to meet you where you want to be met. They don't have it within them. So you have to be able to operate with a person based on how they show you or how a community show you that they are, so that you don't create harm for yourself. Acknowledge the knowledge that you know about your community and about the people that are around you so that you don't create harm. If there's room for repair of a relationship, then I always, say, hey, let's try to repair and create a boundary around how you want to be treated and respected, and really be firm about that. But then there are people who they're like, no, how come you switch up on me, like what, why? And then they push and push and push. And then you have to be like, no, this is not what's going to work. And that's where you have to also know that you may have to grieve the loss of those relationships. Sometimes you may have to walk away from certain relationships because you've set the boundary, you've spoken to them, and they're not taking the cue. They're causing more harm, and they're thinking that the old you still exists. and the old you will take the same sort of beating, the same sort of verbal language, the same sort of behavioral, and then you're like, no, I'm not trying to cycle back there. And it's okay to walk away from that. It's okay to want to repair if it's repairable, and it's okay to walk away if it no longer serves you.
A lot of the times these issues stem from things such as poverty and thinking, okay, I can't leave the situation because if I don't, then I have nowhere to go, I have nowhere to lay my head. There's so many things that are tied to these relationships. I wanted to even circle back to the fact that your work is very specific to the Black community. And I know when it comes on to mental health supports in the Black community, that's a little bit taboo because it's very, we don't talk about that, or, it's very dismissed. I'm Jamaican as you are, and growing up in Jamaica, you would hear a lot of persons say, oh, them just mad. It's a mad person. And without thinking about all the other underlying issues that might have related to this person having mental health challenges and not having enough resources. When I think about mental health and surviving sexual violence specifically, how have you been able to gauge those situations with your client and just having these discussions in the community? Because mental health is already not being talked about, and adding the layer of sexual violence complicates it. What has your experience been like in that space?
So, it's really trying to, what we call psychoeducation, get folks to understand how do we get here, as a collective community. Yes, we're not homogenous in any way, whether you're from the Caribbean or continental African or generationally Canadian or whatever the case may be. But what ties us is our history, right? So really understanding how intergenerational trauma plays out and how the power play that creates sexual violence and the silence that comes from sexual violence, the shame that's created from sexual violence within our community. Many of it's hidden, right? We know that it's happening and we have this culture of, well, we're not going to talk about it. It's not something we bring outside. Whoever is your people, we have to protect your people, even though they've harmed you. And then cruxing that with mental health, it's really understanding that when harm and conflict that is both historical and current is occurring in our bodies and in generations now, people will have health-related issues, right? So some people within the community will show up and say, well, I have stomach issues, I have headaches, I have this. And it's being able to teach them the crossover between the physical health and the mental health. And when the brain is heavy, the body will feel the weight of the experience, right? So you hear people with high blood pressure, diabetes, all these different chronic pains. It's because they have a chronic history of whether it's sexual violence, physical violence, community violence, so many forms of violence. So the conversation is always psychoeducational. Do you understand intergenerational trauma? Do you understand the history that you come from? Do you understand how it's affected you and how family dynamics may present today? And do you understand that with these presentations, it does create mental health issues, right? And naming them. So once you're able to kind of name them where they're able to say, oh, that may I go through, oh, that may I feel, oh, you know what I'm saying? And once you're able to kind of move away from the scientific language and move to the everyday language of what they're experiencing, then they make the necessary bridges and they're like, oh, so that is mental health. That is where it's coming from. So once it's more on a human level, then they'll be able to get it. Once people they're like, oh, that makes sense.
And then you're better able to do the healing work from that point on. Because understanding that what happened to you isn't your fault. You're the victim here. But there's a possibility and you have the power to rewrite your story. And to tell your story and tell your truth, not in the way that someone else has shaped it, not in the way that someone has led you to believe, but what you actually experienced. You now have the power to do that and turn your situation around and use that as something to not only empower yourself. And I also wanted to know, what are some tips or some practical things that listeners could possibly do? If there's a listener is living with, say, an abusive partner, or they've been a victim of sexual violence and they've just been struggling to have the ability to step.
So I would say that practical tips, if you're still living with an abuser or around them, it's really about what's your readiness? Like, where are you in your readiness to want to see change, and asking yourself, where are you? The first thing I would suggest to do is plan, right? To sit with yourself and make a solid plan on the ins and outs of your abuser, the ins and outs of your life, what's going on. Make a solid plan. The plan needs to include a trusted person, somebody you may know out into the community, someone you may know around. What are things that maybe you cherish and want? Or how are you sort of packing those things away? Like creating a plan. If you were looking for an exit, what does that exit plan look like, right? Down to the T, it's how are you packing up? How are you connecting with someone outside to kind of support you? Do you know where you may be able to go from where you can't go? And really building that sense of community to connect with someone, someplace, something that can create that exit for you. Knowing that you already, once you have the readiness within your spirit, within your soul, you are stronger than ever for you to be able to say, I'm getting up, I'm going. Trust me, you're going to make it. Yes, that belief that you have in yourself, you're going to make it. No matter where you decide that you're going to get up and go, you're going to be just fine, because the fact that you believe in yourself and you have that initial strength, it's going to take you further than you would ever believe, right? So if I would say, it's trust yourself, believe in yourself, and plan. Create a really good plan that you can flow with. You know what I mean?
And as you think about, these persons taking their next steps, leaving these situations, and you think about the future and the mental health support are concerned, where do you envision mental health support in the next year? Where are areas you would like to see the communities and Toronto? And what are you doing to help that mission?
Where I would like to see improvements is definitely platforms like this, more conversation, more physical spaces that people can go to, that is culturally affirming, that is trauma informed, that is consistent, and has the budgetary framework to support people who need a base to kind of get out of these spaces, somewhere they can know, okay, I know that I can go to this place. I don't have to stay here, seek a job, live for a little while, be safe, and get myself together. So what I would hope for is more of those spaces, more accessible spaces that acknowledge the difference, that no one is ever is the same. You know what I mean? And we can't bunch everyone together in terms of the experience, and it needs to be really informed by survivors of these experiences, right? So people who are now giving back, who have sort of passed the threshold of healing. It's a journey, right? But they're at a threshold of healing that they want to give back, right? We need to have people like that sitting at tables that create spaces that are healthy for people, right? For myself, where I'm at in a lot of this work, I'm not doing enough. I have to be honest in that I'm not doing enough. But anywhere that calls me and is aligned to me, I'm going to show up. That's where I'm at right now. I have to also recognize my own capacity and my own time and be honest and honor that. But also at the same time, if there is space for me to shout, to talk to any sort of political personnel or person who has authority within the city, and they can hear me, and I know I'm making that connection. Let's make it happen. I know somebody who knows somebody.
And I mean, like you said, having a platform like this podcast, is so important for this kind of work, because we hope that it reaches the right ears. We hope that it will, the victims, the survivors, and the persons in community that should be helping to make the change will hear this podcast and be like, you know what? There's more I can do. Or I know someone who is a victim. I'm going to show up and be a better community member for that person, rather than being in the kind of mind frame like, I'm gonna mind my business. I'm gonna drink my water, because, like you said, we need each other. People need people, and community is so important. And I've been hearing a lot of this. You can't want a village if you're not willing to be a villager. Conversations on social media, but it's true, so true. I think we have the opportunity to be a helpful page. Everybody is able to listen to this podcast, watch this podcast, have the ability to be a helpful. I think we all know someone needs help, needs, especially as it relates to their mental health, whether or not they are victims and survivors of sexual violence. There are also things that are happening in life that affect us all, our mental health and mental stability. So just being a good villager, making that conscious effort to say, you know what, I'm going to show up, I'm going to help, I'm going to be a part and make a difference with my friends. And it doesn't have to be some big organization. It starts at home and it starts. So taking those tiny steps, sending a quick message, calling, just being intentional, connecting with the people that are around you, really getting to understand them, learn their stories. It's so important. Them having not only ability to professional healthcare, because you can always direct them to that, but also knowing that they have that community that is having a strong sense of really, really important. Could you tell me, Gail, some of the mental health support services that you know in Peel and Peel and Toronto, sorry.
Yeah, so a few that I know, I had to write them down because I'm like, okay, what do I know? What services do I know? So for mental health services, I know there's Peel Children's Center, family-centered mental health. There is, if we're looking at a well-rounded community support, there's also the Punjab Community Health Services, Elizabeth Fry Society of Peel and Halton, Victim Services of Peel, Roots Community Services is an Afro-centered mental health services. Right, for human trafficking support, I know that there's Covenant House, maybe even Revive here.
Yes.
Yes, can't forget Revive. And there's Peel Human Trafficking Services as well to support folks who are dealing with human trafficking, sexual violence, and mental health. There's also Sankofa Psychotherapy and Consultancy Group, which is my affiliative collective group, and I also do work privately, Gail Wilson Counseling Services.
Thank you. I love that you mentioned Sankofa because, well, correct me if I'm wrong, but Sankofa is that word that's turning back. And you were mentioning how when victims and survivors are also getting to the point where they can look back on others as well. I thought that was so symbolic. It's important that you're now in a better place where you recognize that sexual abuse, violence, human trafficking, it's happening every day as we speak. And I think some people think, oh, that's a thing of the past, but no, it's happening every single day, every single day. And I think we ought to make that sink in. Thank you so much, Gail. I think this was a great conversation. Is there anything that you'd like to share with our listeners before you go that we didn't touch on?
I would just say that you have more strengths than you think that you do. And it really just takes for you to have that one thought, that one push to say, I can and I will do it, right? And to trust yourself as you embark on your mental health journey, on your healing, and knowing that it is a path, it is not a destination. So take your time with yourself, give yourself grace, and understand that you're stronger than you know.
Thank you. Thank you so much, Gail. This was a fabulous conversation. I feel empowered, and I hope our listeners do too. And I hope for persons who are in situations where they're currently trying to think about their next move, like you said, make a plan, make a solid plan, and get out. Know that there are support services that are here to help you to discover a new you and empower. So thank you so much again, Gail, for coming and sharing with us today. Thank you again, listeners, for being here for yet another episode of the No Longer Silence podcast. We look forward to having you in our next episode. Share it with your friends, share it with your family. We appreciate it. Till next time, stay safe and walk.
Yes, many blessings.
Bye.
Thank you for joining us for the first part of our series in the No Longer Silence podcast. I'm your host, Khdrea Jones. We hope you've had a great time
listening and learning from our survivors and our mental health professionals. The next voice you'll hear will be Jolene Stennant speaking with more professionals and more community advocates. Until then, stay safe and walk good.